Welcome everyone, this is Cody from Peak Fitness in Dieppe. Today we're going to be going over some foam rolling sequences and techniques for the adductors, the VMO, and the groin muscles. First off, knowing how to use this is going to be step number one. And what the goal here is just to kind of loosen up the area so then we can go and gain a little bit of mobility and maybe get a little deeper into our stretches. When we are foam rolling, we're always going to be scanning the area first, so rolling on the foam roller, finding any trigger point. The trigger point is going to be a sensitive area. Once you find that trigger point, you're going to stop rolling, you're going to stay on it, you're going to breathe in through your nose, out through your mouth, try to relax as most as you can. We're looking for a 7 out of 10 intensity here. If you are on that trigger point and it's hurting so much that you cannot breathe, you're pressing a little too hard, find a way to back off a little bit, relax, and move on. Time to release something, or release a trigger point, 30 to 40 seconds, and then that should be it. Move on from there. Could be a little bit longer, depending how sensitive that area is, but after 30 or 40 seconds or so, just move on and come back at a later date. Maybe it's something that you'll have to foam roll more frequently if it is that bad. So, what we're gonna do today, we're gonna begin by going through kind of that medial side of the leg, so the inside of the leg. So the VMO muscle is that little teardrop on the quad. The adductor runs on the inside of the leg here, and the groin, we're gonna get in nice and close to that inside hip. So first off, we're gonna concentrate on splitting this into two parts. So we're always going to start from the middle, working our way down, and then from the middle, working our way up. With these big muscles, when you were scanning the area, if you were to do the whole length of it, might be a little bit too long, a little awkward, so we're always going to section those big muscles off into two. So let's start off by placing our foam roller lengthways. You're going to drop down onto your elbows, bending the leg out to your side, and we're going to place that foam roller right in the middle of our thigh. Okay. From here, even just placing that foam roller could be sensitive for some people, and that's okay. If you want to go a little bit deeper, drop the elbows down, driving the knee into the ground, and from here, I'm going to work my way down to the knee. So I'm going to scan the area, I'm going to play around with the angle of my lower leg, hitting that VMO, getting the adductors, and again, just scanning the area, finding any sensitive areas. For me today, my VMO is a little sensitive, so I'm gonna spend some time on that muscle. So, applying a little bit of pressure, waiting here, 20, 30 seconds. If it's not releasing, I'm gonna go and start doing some active release. So I'm slowly going to bend that knee, 15, 20 reps or so, and then move on. Okay. From there, we're gonna work our way up to the groin. So again, placing that foam roller at the middle, I'm gonna scan the area, getting as far up as I can, playing around with the angle of my hips, trying to find any sensitive areas called trigger points. Once I find something, I'm just going to stay on it, 30, 40 seconds, and then that is it. And then repeat the same process on the other side. Don't forget to breathe. We're looking for a 7 out of 10 intensity here. The whole goal is to release something, not tense it up. Thanks, guys.